Well, I think I will not bother going through the ground rules again once we get that. But, okay, there we go. But I will reintroduce the meeting just so that we have it on the record. Again, this is Numi Griffiths. My pronouns are she, her, and hers. I'm a senior policy advisor with the Division of Financial Regulation at Oregon's Department of Consumer and Business Services. This is our Rulemaking Advisory Committee meeting for 2021 Senate Bill 763 relating to the licensing of pharmaceutical sales representatives. Going to start off with introductions for the RAC members. In order to try and limit crosstalk, I'm going to do it basically as a roll call rather than asking people to jump in. Do we have Anne Murray from Bristol Myers Squibb?
We do. Good afternoon.
Good afternoon, Anne. And we have Asher Lisek from Pharma.
Thank you. I'm here. And with me, I have Daria McGrew. She has since been hired to take over as Director of State Policy for Oregon, amongst other states. And so she's here today to listen and learn, and then we'll be taking over going forward for Pharma.
Well, welcome aboard. And hopefully things are nice and spicy today. We'll see how it goes. Do we have Brian Von Hoy on the line from GNM Health?
Yeah, I'm here. It's Van Hoy. Yes. Thank you.
Welcome, Brian. Do we have Chloe Becker from OCAP on?
Thanks, Numi. I'm here.
Thanks, Chloe. Do we have Jen Baker from Providence?
Jen Baker is here. Providence Health Plan, to be clear.
Providence Health Plan, yes. Thank you for the clarification. And we have Maribeth from Osberg.
Yes, that's me.
Hey, Maribeth. And do we have Rick Blackwell from Pacific Source?
I am here.
And possible late addition here, that is the official list I had so far. I understand we have somebody from Oregon Medical Association on the line as well.
Yeah, Mark Bonanno from the OMA. Thank you.
Welcome, Mark. I had hoped to confirm provider representation on the group, and so I'm glad you're here. If you don't want to formally be a member of the RAC, then please let us know. It's like this is not necessarily the fixed and final list, as I know there's a lot of interested parties, and we're trying to get this process going on a fairly short timeline. If there are other folks who are interested who would be interested in being a member on the RAC, I'd encourage you to reach out to either Karen or myself in an email. I think there's some segments of stakeholders that we are already adequately represented on, and others maybe that we could use some more perspectives on. That's like I reached out to as many people as I can, but of course it's always possible for there to be oversights. So just for the format of this meeting, I'm going to give a quick overview of background for the law and the sort of scope of rulemaking that we're considering as the department. And then I don't have a super formal plan for going through the draft rule itself. I recognize that I only sent out the draft language yesterday, so I wouldn't assume that you would have had time to go through every bullet point in incredible detail yet. So my plan for today is basically to run through the draft. I will go ahead and share my screen once I'm getting onto that, and kind of run through the sections that we've put together so far, where they came from, and what our thoughts are, and if any issues come out kind of at this early stage, then we can kind of start developing that conversation and see if there are things that need to be changed or improved in the draft language before we move to a final rulemaking. So 763 passed 2021. It had in the 2021 legislative session. It's a licensing program for pharmaceutical sales reps. It is to be implemented within the Department of Consumer and Business Services. Our our licensing team that works on a number of insurance issues is going to be the sort of lead team that's actually working on the program once it gets rolling. If there are questions related to the sort of mechanics of licensing, et cetera, we do have Haven Garber on the line, who is the manager of the licensing team. And so she may be able to provide some insight on some aspects of this that I can't. So she will be available. And in general, what we have tried to do is to only write rules where they're needed. Where the statute itself is already clear, we generally try not to elaborate on that further. So there are some terms which are used throughout the rules, which are defined in the statute, and therefore I haven't I haven't put a separate definition in the rule text itself. And just one other thing. So the effective date for this is January 1st. I think that given the complexity of this, I'm not going to get everything together for a permanent rule posting to have an effective date of January 1st. So probably what we are going to do a temporary rule, which will be effective on that date. And at that point, after we've, hopefully the content will be more or less finalized at that point. So there won't be changes between that temporary rule and the final version that goes into effect several months later, but you never know. And I'm hoping we will get lots of work done over the next few meetings. So unless there's any questions just on the sort of general overview, scope of rulemaking, et cetera, before I dive in. All right. Just make sure I find my right screen to share with you all. Okay. Can everybody see that okay?
Yes.
Thank you. So I'm just going to run down the rules basically, caption by caption. And if any issues arise today, then we can discuss that as things arise. Initial and all the rule numbers are placeholder. My expectation is that this is going to end up in Chapter 200, which is our regulatory, or 836 Division 200, which is the regulatory programs that the division operates. So, for instance, our licensing, our registration program for PBMs, as well as the transparency program, the rules related to the transparency program for drug manufacturers is also under the Division 200. So first one, not controversial. This is just a citation back to Chapter 593 of 2021 Oregon laws, which is the final resting place of Senate Bill 763. And then moving on to definitions, I think that this is pretty straightforward stuff for the most part. Department, of course, is DCBS. I have added this definition for pharmaceutical product, and that I have specifically put in that this is a medication approved for human use. This was due to some concerns that were raised by the representatives for the non-human prescription market were concerned about being clear that the scope of the law was limited to human prescription drugs. Because from my understanding from speaking with proponents of the bill, including the legislators, is that this was intended to apply to human prescription drugs. And so we put in the definition just to avoid any potential confusion around that. Pharmaceutical representative is just simply the term that I've chosen, comes from the statute, and that since we're using it as shorthand throughout the rules, I felt the need to put the clear definition. License is a license under these rules. Licensee is a person who's been issued a license under these rules. Calendar year, I think, so this is related to specific statutory language that it is written down in the statute that a license will expire at the end of the calendar year, I believe. Was not necessarily my preference to have things run from basically January 1 through December 31st, but that is, damn, I can't find it. Well, so I defined calendar year just in reference to language back from the statute, so that licenses will need to be renewed basically in advance of January 1st for people who are intending to continue operating as pharmaceutical sales reps in the state of Oregon, that they will need to renew basically at the end of each year, regardless of what point in the year they had set, at what point in the year their license had started. Material change. This is a term that shows up later, that shows up in the statute related to reporting requirements. That basically, it's a statement that requires material changes to information submitted in the application, where pharmaceutical sales reps who are licensees are required to update the department within 4 days of the change of that information. That is in the statute. So this term needed to be defined. And so for the draft rule, so that is a change in business activity, termination for cause from any employer or company that the licensee represents, or any complaints made to the licensee in relation to their activities conducted under a license issued under these rules. Let's see. And it looks like I actually have a typo in here from an earlier draft. So I will go ahead and say that that is not supposed to be there anymore. So you can safely ignore that. So is there any questions or discussion related to the definition section?
I got a quick question. I'm sorry, and maybe I missed this and maybe it's in the legislative preamble or something. What was the purpose cited from the regulation for creating this requirement?
My understanding from the proponents is that there's concern about monitoring the marketing activities of prescription drugs. And basically, the idea was to create a sort of professional education and monitoring program, kind of similar in some ways to what we do with lobbyists. So government relations people in the state of Oregon, we require quarterly financial reports. Some of the reporting requirements in the law are mirroring in some ways the reporting requirements we have for lobbyists, but the primary proponents of the bill were OCAP, the Oregon Coalition for Affordable Prescriptions. But we do have a representative on the call, so maybe they would be a better person to speak towards what the legislative intent was behind this.
Thanks, Numi. I think that initial explanation you gave makes sense, and I'll just add to that I think the other portion was really just putting these representatives into a licensing program similar to a lot of other people who are in the healthcare system, and just trying to get some standards and basic education, things like that as a part of it as well.
Yeah, thanks, Chloe. Do we have any other questions or discussion at this point?
Numi, do you want to talk specifics, or what's your question? What are you opening the door for?
Pretty much it's open for anything at this point, but like I'd like to keep it to basically one rule section at a time. So like if there's anything that's related to any of the definitions, concerns that have been raised by what I have included, what I haven't included, the way that things have been phrased, that's basically what I'm looking for, just to focus the discussion to more or less one thing at a time.
I will say I have a very cursory review of the rules to date, and I will comply with your timeline for comment coming up. But in the what stands out from what you just reviewed is in the material change definition. In the statute, it refers to material change that the licensee made in a licensee's business operations. Yet the rule seems to expand that to material changes that the licensee may or may not have had any kind of control or knowledge of. So I'd ask that you just take a look at that section in light of what 763 actually says, and consider narrowing that down to make sure that you're asking licensees to report information that they actually, have access to. It's the licensee made that's missing the language that's missing from the statute.
Got it. Yeah, no, I appreciate that being pointed out. I will go back and double check that and make sure that our wording in the next version of these rules that you see is consistent with the statutory language.
Thanks.
And I presume that you'll probably send me a written version of that comment as well.
Okay.
You don't need to. I'm taking it down. But if you want to, you can. Let's see.
I guess the other question would be, you may have people that no longer are employees. They weren't terminated, but they are not, they left on their own reasons. I guess that's not a material change, or that's, you would want to know they no longer need a license. They no longer work for us.
I imagine, I think this is the portion of the rule of this particular rule caption that I was most concerned about. So some of these things, so these two clauses are related to things that were either suggested by people on our licensing team or were from changes that are required to be reported in our other licensing programs. Given the difference in the language that Don has pointed out, I think maybe this isn't the right place for this in the rules, and that might be something that I end up moving these and making sure it's not in the sort of 4-day timeline, which I recognize is relatively short. So if this is basically saying material change in a licensing business or operations caused by the licensee, then maybe that's something that is in there. I don't know if we have any sort of thoughts on legislative intent as to what that particular provision was. Chloe, do you have any insight on that?
I need to check and circle back on that piece.
Okay, thanks. All right, well, unless there's anything additional on definitions, I'll go ahead and move forward. And I think what I've realized is I cannot actually see the hands raised while I'm sharing my screen. So for folks who want to jump in, please just go ahead and jump in until I've pulled the share screen down. Okay. So second rule caption we put in, this is just kind of spelling out the rough requirement. So clarifying scope of what this applies to. This comes more or less straight from the statute. It applies to people who are doing business 15 or more days in a calendar year in the state of Oregon. And so doing business as a pharmaceutical representative with healthcare professionals, well, both are in the state of Oregon. This is taken not quite verbatim, since I've swapped words to make it fit to state. This is taken mostly from the language of the administrative rules for the city of Chicago's pharmaceutical sales rep licensing program. So that is where I have borrowed this language from. It's a license issued is valid until the end of the calendar year in which it was issued. It's not transferable. This is in the statute, but I felt it was important to include that. And then we have the provision here. This is taken from Chicago and not from the statute, but it provides that pharmaceutical representative must show their license or a copy of it when a healthcare provider asks to see it. And I've gotten the feedback from our licensing team that this can be done through display, basically, of the registration online. Any questions or thoughts about the licensure requirement section as it has been drafted?
Numi, this is Rick. Would this, so the showing the license would essentially be like the NMLS numbers, right? And Haven, you might be able to say this in more detail, but you know, you have your mortgage license number at the bottom of your email or something like that. Is that kind of what you're thinking?
Hi, Rick. Yeah, this is Haven. So this license type will actually go through SPS. And so you either the licensee or the public can search and receive information that the person is registered. And so, and on NIPR, the individual licensee would actually be able to print a certificate if they wanted to, or they could bring it up on their phone to show it. So I don't think there's any requirement that it's like on every solicitation or email or anything like the NMLS number, but it is a similar idea.
Okay, thanks.
Thanks, Haven. Other questions or concerns on license, on the license or requirement draft rule? Okay. And one thing I will note is that I did find the statutory text I was looking for, which is on the calendar year, basically that, let's see, as sub C of the licensure section, and 763, license the director issues is valid until the end of the calendar year in which the director issues the license. So that is that term of licensure is not based on our preference. That just comes from statute. So,
Is there any consideration of, oh, I'm sorry.
Go ahead.
Yeah, any consideration, so if it is a calendar year and an employee comes on, maybe they start in October, is there a prorate? Will they consider prorating the annual fee, or is there like a certain time frame where you know, you register within 3 months of the end of the calendar year, therefore it's going to carry over to the following year, or something like that? And maybe it's too early to ask that question.
I think I would need to check with some folks to see if that would be a permissible interpretation of the statute as written. I think having that sort of flexibility could be a desirable feature for the program, but my feeling in drafting in relation to the sort of calendar year requirement is that we are somewhat restricted in how we can interpret it. That the statute expressly says a license issued under this section will expire at the end of the calendar year. It also says that the application will be accompanied with a license by a license fee of $750. So that really limits our capacity to either to change the license fee. We don't have any capacity to adjust it to meet the needs, revenue needs of the program. We don't have the capacity to say that license expires at a different point in time. So I think what I can do is I can take that back on our end and see if legal thinks that we have a bit more flexibility, and check with some other folks. Haven, do you have any thoughts on that? If we have flexibility beyond the statute, or if we're kind of stuck with what we've got right now?
I can tell you in other programs, we don't have that type of flexibility. We have an application fee and then a renewal fee. Those don't always match up the same dollar amount. And I read the statute as being, or the bill as not allowing that flexibility. And there's also a question of whether or not we would be able to do that through the software programs that we're using to process these applications. And none of the other programs that use this particular application has that flexibility that I'm aware of.
Okay.
Thanks, Haven. I think that's helpful. So I think given the way that things are written right now and the sort of administrative concerns, the answer is no, that we're not doing.
Maybe, if
yes.
it's okay, I just wanted, it's Jen Baker. I just wanted to make sure that, you know, when you do look into that, we remain consistent with what we do with other licensees. And my understanding is that we don't. And so there would not be that flexibility. So I would not want to make a certain exception for this particular license.
Yeah, I was asking because I think that's in some of the other laws, similar laws that I've seen. And it's, you know, obviously from a company perspective, it would be, well, maybe I don't hire somebody in December or November, you know, because maybe they won't be 15 or they're going to be $15. Well, let's wait till the next year because why spend $750 now? So those are the implications that'll happen with companies.
This is Haven again. I will say just for this initial kickoff, the plan is, since we don't want everyone applying on January 1st, 2022, is that if we have the ability to accept applications prior to then, that for this year, anyone who applies before that December 31st deadline, their license would be good until December 31st, 2022. But that is the only time that, as of now, that's permissible.
Hey, Jen beat me to it, but yeah, I was going to say, I don't remember ever a license type at DFR that had a proration period, mostly because of the complication.
All right, appreciate that. Thanks, Rick. Thanks, Jen. Thank you, Haven, for the input on that. Any questions, thoughts, concerns regarding the licensure requirement language?
Yeah, Numi, hi. Sorry, this is Barbara Morrow with Astellas Pharmaceuticals. So a question I'm sure I'm going to be asked, since there won't be any prorate, and I apologize, there was someone else who spoke about for this year only that companies could get their sales reps licenses in before the end of the year, or the applications, if you will. Are those applications ready yet? I mean, could a company now begin applying for the existing Oregon sales reps they have?
This is Haven. I'll answer that. And the answer is simply no. We are currently working with NIPR and SBS, who will be helping us with the technical part of this. And we're hoping something towards the end of November.
Got it. Okay. Very good. Thank you. Appreciate that.
No problem.
All right, appreciate the question coming in. I'm gonna go ahead and move on. If anybody wants to roll back to the second rule caption, we can go ahead and do so if anything comes up. So next rule is just general specifics for license application, as well as applications for renewal of the license. Basically stating the requirements for submission, that we have set this out. That's basic information, description of the business in which the applicant will engage. That is taken straight from the statute. Documentation that the applicant has completed 10 hours of professional education. The initial education requirement is not specified in the statute. We are given discretion to define that by rule. That is further discussed in the fourth rule caption. So maybe we can get a little bit into that as we move on. Application for licensure must be accompanied by license fee of $750. That dollar amount comes from the statute. We can't change it. And has been discussed, we haven't done any sort of proration for our other licensing programs in the past. It would not be realistic, I think, for us to do that in this particular instance. And provisions for renewal under sub 2 may apply for a license if they held a valid and unrevoked license to the end of the preceding calendar year. And we've asked for them to submit the renewal application on a form at least 30 days before the license expires, containing, and most of this language is the same as what I had put down for initial application, basic contact information and identifying information. Again, description of the business the applicant will engage. Documentation of CLE, and this is, I'm wondering if I have changed that language since I had originally drafted, but, and we've currently set renewal fee $750, which is the same. New caption here, or new element here, is that we will have a timeline for abandonment. If the process has been started but not completed within 30 days, we will consider the application abandoned and no longer consider it until it is resubmitted. And finally, that the $750 application fee is not refundable. So that is the sort of general outline that we've had at this, that I've put together so far, sort of for contents and the nature of applications, for the initial registration, as well as for renewal.
I just got a real quick technical thing.
Yep.
Maybe whether it's nitpicky or not, but it says that you have to submit the following information. So maybe it needs to be the following information if it's available, because most people, or a lot of people, don't have phone numbers at their residence. You know, they have a cell phone. So not all that may not be applicable. And that would be in both sections.
So maybe we could make it more generic,
Yeah.
personal phone or something, but we need, as the licensing department, need to be able to reach people, and that's kind of a requirement on all of our applications. So maybe it's just a matter of wording rather than residence telephone, but maybe personal
Right.
telephone.
I think, you know, I know I haven't had a residence phone or home phone forever.
Right.
Yeah.
This is Barbara Morrow with the Stellus again. I apologize for all these questions, but I'm going to be asked them, so I might as well ask you guys of them. Where you said that the application for the license, that they must submit documentation to show that they've completed a professional education course. I'm really more thinking about this year. We're already in early October, so most of the drug companies are going to want to get their applications in as soon as, you know, you have it live, right? But so my question goes to the professional education course. Will it be offered between now and January 1st, or is it something that they can take early January? You know, I'm just trying to find out about the education.
Sure. I recognize the timeline is pretty sensitive at this point. It's possible that we could use a more limited CE requirement for the first year of licensure, considering kind of getting continuing education classes registered before the end of this year,
Right.
even conceivably towards the end of next year, in terms of looking at the 5-hour requirement for license renewal. Evan, do you have any thoughts on sort of flexibility around the CE side of things? That's more in your shop than in policy.
Yeah, that's a really good question, because typically there's an approval process, and I realize that it's already October. I think I would have to look into that and provide more information. And it may be, you know, more of a general taking of a class and proving that you've taken some kind of class without being as specific as we will be in the future, where there's a process of accepting CE and pre-licensing credit. But I'll have to talk to some
Yeah,
people.
if I recall other jurisdictions, you mentioned Chicago, but I know that in the past, others have on that first year taken, you know, you've already been a rep, you're an employee, what are your training records at the company? What were they? Did you have compliance training? Did you have, you know, your product training? All those categories and certification for the company for the first year. And that's what they used because they had the same problems. There was no approved education when the requirement came in. So just to throw that thought out there.
Yeah, I'll be happy
really
to look into that and deliver information at the next meeting.
Yeah, I think at this point, what I will plan to do is to throw together basically a temp rule for first year in terms of how we will address the continuing education requirement. I'll see if I can have some discussion with my counterparts in jurisdictions like Chicago and DC that have ESR licensing programs already and see if we can get some insight into how they navigated that. And so I'll try and put something together. It's like, I think that it is unrealistic to have the sort of initial requirement in place for this year. So we'll look at options for that and hopefully have some draft language that I can present to you at our next meeting. And we'll discuss that internally and as well in terms of looking at how we're going to verify that, how that process is going to work with Haven's team and licensing, and what we're going to do with that moving forward. Any other questions or comments on rules related to license application and renewal? All right. Hearing none, I'll go ahead and move forward. So we've set up education and continuing education requirements. I've set basically I structured this rule with two subsections, one of which is related to CE requirements for initial licensure. The second is education requirement for license renewal. And have kind of set out basically the expectations for the one. So for initial licensure, this is not clearly defined in the statute what the expectations are going to be. And I've tried a little bit in terms of looking at other jurisdictions in terms of seeing what they have asked for there. Chicago basically has something that is along the lines of these first two requirements, plus I believe the professional ethics element. So where the initial C program is related more to the specific licensing program, rather than being about being a pharmaceutical sales rep more generally, in terms of trying to think about priorities that people were looking for, since this has come from coalition that is working primarily on cost control. I threw in these two as potentially being sort of touch points that could be useful for the sort of initial thing in terms of the way that we are regulating how people are talking to medical professionals. Certainly professional ethics is important, but also kind of really talking about the expectations for the effectiveness of drugs and the cost effectiveness of drugs. So this is one where I think, like, in consideration of what we've had, the discussion we've had around the sort of first year of implementation, I'll probably make some adjustments to this for the next version, that considering that, as people have said, so people already have training internally, and in terms of timelines, trying to make sure that education happens up front, maybe it does make more sense to kind of just focus on the specifics of the program itself and have the other elements of the profession in the continuing education, the requirement for renewal, but I'm open to suggestions on that. Second half of the rule that has been referenced to continuing education requirements for renewal. This is in the statute, is 5 hours. So that is not something I have flexibility to change. Basically, it says by applying for renewal, you are affirming that you have completed at least 5 hours of continuing education. I've set out a number of rules later in this draft related to certification and registration of continuing education courses that will fit under this program. And we'll get to that in a moment. And then set out basically a list of topics that should be included, which should be basically not saying that each of these needs to be included, but these are the subject areas that are eligible for consideration for continuing professional education credit for this license. It's general medical pharmaceutical technology, FDA laws, comparative cost effectiveness, therapeutic drug classes categories, professional ethics, again, properties and actions of drugs and drug delivery mechanisms, etiologies, disease states, pharmacology, anatomical physiological effects, comparative effectiveness, reading peer-reviewed literature, and safe prescribing practices. This is a mix of things that I took from Chicago CE subject list, as well as there are a number of things that are listed in Senate Bill 763 that I just pulled directly into here. So that's where this is coming from. Any questions or comments related to the sort of general CE requirement draft?
The only thing I was going to say is I know there was the renewal had to be within 30 days, right, of expiring, and this is the previous section. What would happen if you didn't know you needed it and you didn't do it within 30 days? Is there? I mean, that planning is important, but sometimes you don't know that you're going to stay. Is there implications for not doing within 30 days?
I think that is something that we can address in the next draft. Probably the best way to handle that within our structures would be, rather than to allow renewal after the expiration. And so the 30-day requirement, I'm trying to remember where that came from. That was pulled from some existing rules related to our other licensure programs. I think given the way this is structured, I would be comfortable, I think, with allowing renewal anytime in the following calendar year. So if you have a license in the previous year, as long as you've applied, completed the CE, completed the requirements, submitted the fee, that you would be able to apply for renewal in the following rule. That's, I think, something I would be comfortable with. Haven, do you think that's workable, or do you have any thoughts on the way that we're structuring renewal, if it should always be attached to the beginning of the year?
Yeah, so the way our software systems work, right, is that something has to happen to the license. So if you don't renew by December 31st, the license has to do something. So it would become expired, and that person would technically no longer be registered with the division. It would no longer be able to work in this capacity. And doing so would be that they're doing it without a license. And since the renewal fee is the same as the initial fee, they would have to basically reapply and make sure that they have the required education completed for the previous year. So I don't think there was conversation, Kirsten, I had a conversation about them needing to redo the pre-licensing CE, but to make sure people don't avoid renewal just so they don't have to do CE. So just making sure that people are completing their CE, but they would have to pay the $750 again.
Yeah, and I think one of the things you could consider on that would, and I think as you said, this is like licensing of other healthcare professionals that work in Oregon. For example, as a pharmacist or a physician or whatever, I think a lot of times their licenses lapse. Like if they didn't send in their CE, they still can practice medicine. It's not that your license is revoked, it's lapsed and then they fix it. So I don't know if there's any correlation on something like that.
Based on other license types that I've dealt with, if a license expired, it means that you're no longer licensed to do what the license allows you to do. So it would be an actionable item that would be basically kind of practicing without a license, and it would be actionable, meaning that, you know, if enforcement got involved, we could say that they were practicing, they were participating in this industry without a license.
But that would be only if they were doing it for more than 15 days in the next year. So there
Right.
is the catch there that the license is not required until they actually have participated in these activities for, forgive me, I don't know the exact language, Numi, up to 15 days or no more than 15 days. So the expiration of the license may not give rise to any kind of action or activity or enforcement, because potentially it may not be required until the 15th of January or whenever they surpass the 15-day window.
That would be correct. Yeah, there is that exception in this statute.
So the system would need to recognize that, obviously. So
Right, 15 business days. Yep.
yeah, or 15 days of doing the work, right?
Yep.
So the
Assuming you don't
language
work on
from-
weekends.
The language from the statute is fewer than 15 days. And
Okay.
the way that I phrased it in the rule is that you need a license if you are conducting business as a PSR for 15 or more days. That is quoted more or less directly from the Chicago rules, which have basically the same structure for the timing. So that would be true that it's conceivably, in a lot of cases, somebody wouldn't absolutely need to have the license until potentially months into the year before they've kind of gone over that threshold, and then they suddenly would need the license in order to continue doing business. But for sort of planning and convenience factors, I suppose it is in the incentive for a rep
Sure.
to renew their license ahead of time.
Yeah, I know it makes sense. I think that's how we actually manage it in Chicago. But to the extent that when you start talking about expiration and enforcement and doing the job without being licensed, then that obviously raises some significant red flags in terms of nomenclature there. So
absolutely. I think the main the likelihood of the main consequences for somebody who does business for 15 days and then continues doing business without having acquired a license or renewed a license would probably be civil penalties at this point, since that is what we can apply, what we have the authority to apply. So like that's where that would actually fall. Questions or comments? Any further questions or comments about the general CE requirements as drafted? It looks like I will be looking at pretty significantly revising section 1 here, but all right. I will go ahead and move forward. So the bulk of these rules are, the rules that are coming up next are related to sort of continuing education requirements that are taken straight from our rules related to continuing education for insurance producers. And so that is where I have tried to go through and make sure that I have caught all of the references to insurance producers and changed them and removed things that are inappropriate to the pharmaceutical representative context, but I'm sure I've missed a few. So that is in here. These are pretty in depth, so I won't necessarily go through these in depth, but maybe in terms of looking at things to call out. This first one, I'm just general on continuing education, just talking about the documentation for proving that somebody has taken things. So provide sort of generally for documents for academic credit, transcript, certificate completions, etc. For registered courses that are basically registered under these rules. And there is actually set out something here. This is again taken from our insurance rules. Statement of the hours of credit, name of the pharmaceutical representative, date of the course, and the course registration number. Since that's referenced in our own system, we don't need the same sort of outside transcript. And then there are terms which are related to courses which are not registered and not offered for academic credit, and there is an entire rule devoted to that. And basically, said that we'll accept this through electronic means. I believe that's going to be going through SBS as well in some format. Is that right, Haven? Maybe.
Sorry, having a problem with the mute button. Yes, that would be set up through SBS, that the providers of this CE would get registered with SBS, and then we would approve it. And then once they're approved, then the courses that they offer would be approved through SBS as well.
Okay, thanks. So I think I will just continue running through these ones for the moment rather than trying to address things but if anybody has anything that really jumps out, like feel free to jump in. We have rules set up for standards for granting credit hours, basically specifying 50 minutes of instruction, that somebody can receive credit for a class that they are an instructor of. That it can't be more than 8 hours a day, that it has to be in the preceding time. And then there are provisions for independent study. Let's see. Has to be completed before the application. And then there is time cannot be counted basically for course prep, travel time, time outside the class time, etc. So sort of similar things along those lines. Provisions for independent study. This is fairly detailed, so I'm not going to go through it in granular detail right now. Let's see, as well as sort of additional factors that for proving that you have taken such a course, that should be proctored, that we have proctor registration requirements, et cetera, et cetera. This continues. Talking about provider registration. This is taken more or less verbatim from the insurance code, except where appropriate changed to clarify that we're talking about this new licensing program rather than the existing ones. So this is all registration for CE providers that lasts for 2 years following registration, subject to rejection if they're not meeting requirements. Course registration provisions. So again, this is if courses registered with us, then there are more limited evidentiary requirements for showing proof of completion as compared to courses taken for credit. And continues. And then we have prohibited trade practices for continuing education providers, not engaging in false, misleading, or deceptive advertising. Charges must be disclosed, et cetera, et cetera. And requirements for granting credit and attendance records, all the sort of proof stuff related to that. And here is the rule, which I believe this is the last of these, which is just related to taking credit for unregistered courses. So that's for courses that are both not registered with us and also not taken for credit from a 4-year or other accredited institution for which you would be able to submit a transcript. So this has fairly detailed documentation requirements for somebody who wants to use a unregistered and not for credit course as their as fulfilling part of their continuing education requirement. So I recognize that was a lot, and I may not have the greatest familiarity and ability to answer questions since I have borrowed this from the insurance section of our rules and have only kind of lightly edited it. So I'd encourage you to go through these, see if anything pops out. This is tried and true rules that we already use for our other licensing programs. So
Is there
yeah, go ahead.
just a suggestion, or maybe it's something that I don't know if you consider, since a lot of it is very similar to Chicago, is there any consideration of reciprocity for approved Chicago providers?
I think that's an interesting idea. It's certainly something I think worth considering, since I think the programs that exist right now are just Chicago and DC, though I don't know if they have a CE requirement for DC. Haven, do you have any thoughts on the sort of possibility of doing reciprocity?
They would, I know that Chicago is using a different software system. They would still have to go through the process of registering. I know in the past, as far as insurances, we still approve the class. So there are classes like in insurance that are approved for 49 out of 50 states or what have you. And so, but there's still an approval process. And because every state and city is so different, my thought would be that they would still go through our process, which typically isn't all that different from other states. And as long as they met those minimum requirements, then they would be approved here. It's not the same as saying just because it's approved in Chicago, it would be approved here, but there is some flexibility there that, we look at what other states they've been approved in, or cities in that matter.
Yeah, thanks, Haven. Yeah, I think likely, we're not looking to create obstacles to see providers getting registered with us. It's just kind of simply going through due diligence, and since, as Haven mentioned, Chicago's using a different technology platform, probably not realistic to do just straight reciprocity, but I would think that if we have if a CE provider that's already approved for Chicago gets registered in our system, then a PSR would be able to use the same credit hour basically to meet both Chicago's continuing education requirement as well as ours. So I think that
there's another thought on, yes, the pharmaceutical companies also providing CE. I believe one of the jurisdictions currently allow that. Is that being thought of as well?
I think that that's something that we would be open to considering if a pharmaceutical company is submitting courses for registration and so basically submitting as a provider through the same rules, that we would be open to accepting that.
Chloe, maybe you should go ahead. Go ahead.
Oh, I was just going to say, Numi, when I was looking back at this statute, it specifically calls out that the education can't be through their employer. And so I know you were not wanting to be kind of redundant with what's in statute and in these rules, but wondering if it makes sense to call that out in these rules. And also, I think that goes to the question you just asked, Brian, on that front. I think having
that answered it.
not would be something that's already in statute. So
yeah.
And maybe it's in here related to the insurance provisions. I'm not sure if it is, but it might make sense to spell that out a little more clearly.
Yeah, no, I think that makes sense to put in there. I apologize for not recalling that particular provision of the bill. So we appreciate you pointing that out, Chloe. Other thoughts, questions? Go ahead.
Yeah, I mean, I ditto what Chloe said, but I was thinking, is there any sense of, since you're going to have to start licensing people as soon as the statute's operative, right, in January 1st of 2022, is there any sense of publishing a list of courses that might work initially that are proven in other jurisdictions that might get to this idea of reciprocity. At least the training, if you take it in one jurisdiction, could be approved here. You've got the ability to designate and publish that list that provide that professional education. Might be a way to, because when I read the producer statutes, and I read that as kind of the end state, like that's where you want to land, but you still have a lot of transition work to do, right, to get there. And it might be expedient to just copy someone else's work, at least temporarily, and then so you can get to that state, if that makes sense.
Yeah, I mean, that makes a certain amount of sense. And I think maybe that is a way that we get around the first year for this. As I'd said, like, I'm going to try and set up some conversations with my counterparts in other jurisdictions that have already implemented this, and kind of looking into what is out there already, as well as how they've gone through the same problem, not wanting to reinvent the wheel. So that is a conversation that we can have. Like I agree, yeah, that these rules that we have set out for the CE side of things are, as you said, Rick, that are more the sort of end product that we're looking to get to, and may not be realistic to expect this to be fully operational in the first year. So it may be simply something of putting out a CE rule for the first year, putting out and then basically placing an effective date on these provisions that is running from probably Jan 1, 2023 or something along those lines. But I will discuss this internally a little bit more and bring it back next month and get your thoughts.
Definitely enhance compliance early on by doing that.
Yes, no, that we certainly would like people who should be registered to be registered. So I appreciate that perspective. Any other thoughts on continuing education related matters?
Yeah, just one, and this train this is Mark Bonanno, OMA, may already have left the station if we're following this Chicago model, using the word provider for someone who provides education. The statute was pretty clear to refer to just healthcare provider as someone who, engaging in prescribing. But now in the rule, we're talking about provider as someone who provides education. It could get a little confusing for folks, and we don't want to have healthcare providers thinking they got to register as educators here. I'm just wondering if any thought was put to using the word trainer, educator, instructor, something different. Again, the train may already have left that station.
And as I was drafting this, I had the same concern and had considered putting education provider in my definitions as well, but that seemed awkward. And also, we are referencing healthcare providers in other parts of the statute. I do agree that it causes confusion in this instance. And so I will take that back and see if we can come up with a better term that clearly represents that without getting the wires crossed in terms of healthcare providers versus education providers. So, yeah, thank you for pointing that out. I did intend to fix that in some way, but yeah. Other thoughts on continuing education? All right. Well, hearing none. So we are at 2:40, and I believe I had set our public comment period at 2:45, but I will go ahead and move forward in the hopes of actually getting through all of the draft rules today. So 12th rule caption put forward related to reporting requirements. I have set this up, so this is going to be done through the department's IREG technology system for collecting periodic reports. It is the same system that we use for the drug price transparency program, so for manufacturer reporting. And basically, we've asked for 3 different types of reports: the sort of any changes to the information submitted in initial license application or renewal application, and then finally the material changes to the business operations. Again, like I'm going to adjust the language as it has been defined up at the top. And I've set up basically the sort of periodic reports as quarterly. The way that this has been stated in the statute is either upon the request of the director or at such periods as shall be defined by the department. Basically modeling this after the, my understanding that there was some comparison to the lobbyist statute. I've been a lobbyist myself. I'm used to doing quarterly financial reporting. So this is basically modeled off after that, having basically the 4 3-month quarters out of the year, having the reports due on the 15th of the end of the month, 15th of the month following the end of the quarter, excuse me. And the information to be reported is down in the 3rd subsection here. This is from the statute in terms of requirements, healthcare providers contacted, number of times they were contacted, location and duration of contact, which pharmaceutical products the licensee promoted, whether there were samples, materials, gifts, and monetary value, and other compensation. So like I recognize that maybe the quarterly schedule might seem aggressive, but kind of my thought is that it is better to be keeping track of all of your meetings with doctors for 3 months at a time rather than for an entire year. And if it is somebody who's only doing business for 15 days, basically they're going to report 0 3 times and then have 1 report that they need to prepare. So in a lot of ways, I think this is actually less onerous than, say, doing an annual report, basically forcing somebody to only report the information in subsection 3 of this rule at whatever time the director chooses to send a request. Any thoughts, questions on the reporting?
I'll let go ahead.
A shortlistic from Pharma. If you go back up to number 2, so just at the bottom of the page above there, it says a licensee must report the information regarding contacts. It would be very helpful if that could be the licensee or the licensee's employer, so the people in the compliance department can submit a whole batch to you instead of you getting individual reports from each licensee at those companies.
Yeah, and it's the data will be, it's typically ran from the compliance department of the companies. They're the ones that's going to submit it, and not the actual licensees. As far as frequency, you know, I'd rather see once per year versus quarterly. To me, you know, it's going to be the same data. I don't know if by getting it every quarter is going to help you with anything, but. And they can do it whenever they want, right? The director can request whenever they want.
Yeah, I mean, to some extent, I'm somewhat agnostic on the frequency, and having the understanding that we're expecting this to be done more by the compliance department in terms of generating that information. Like maybe it does make more sense to have that be an annual requirement. So I will take that back and under consideration and see if there's any thoughts. I'd be interested to hear from consumer advocates or the proponents of the bill. Do you have any perspective on the sort of frequency of reports that you envision this happening? Does it matter if it's quarterly or if it's annual to you?
Numi, this is Mary Beth from Osberg. I'm pretty agnostic as to how frequent this is. I do have a question about part 3, but I'll wait until this is settled until.
I'll just add, I think that kind of quarterly piece was just kind of the lobbying comparison that was out there. But I think as long as this is all being reported, I could talk with the rest of our folks to see if there are strong feelings either way and supply that next time.
Okay, appreciate that.
Numi, can I ask a question about the
yeah.
reporting? So
Yeah.
I understand having the compliance department report that information, but it just occurred to me as we were talking about it, what happens, and this is probably like academic exercise, right? But what happens if the compliance department does miss a report? Is the liability still on the licensee then to submit that information, or what happens?
So this is Haven, and yeah, when someone said the compliance department, I was thinking, well, one, this bill gives us jurisdiction, right, over the licensee, not their company. So one, it could be licensee or their designee. And we have this in insurance as well, where we have either companies or third parties who are submitters of applications and this type of information. And we still hold the licensee responsible for the information contained in the report and for filing it. So we don't have the ability under this statute to take enforcement action against the company, right? We would only be able to take action from the licensee. So I would just say, you know, when we're thinking about that, keep that in mind, because we do want to be able to make sure that we're getting this information and who are we holding responsible and what is our jurisdiction here. The other thing is, and that's not saying that compliance departments can't upload it, right? It makes sense that they would. It's just who at the end of the day is responsible if it doesn't get done. And I am not, I like the quarterly just because it is frequent and if there's missing information, but it is a lot of manual work to also verify that all the information is continuously uploaded. My one thing that I would suggest is that if we have it less than quarterly, we don't have it on the same schedule as renewals, because one of the things about renewals is that making sure that that this report is being filed and not holding up renewals to find out whether or not the report was filed. So maybe if we're going to do it less than, maybe do it every 6 months, but not coincide consistently with renewals. So just a thought.
Yeah, and your analogy to insurance, there may be a difference in whether, you know, types of employees, W-2s versus 1099s. I don't know.
All right.
Yeah, I'm not sure that it would make much of a difference. I think both of that happens on the insurance side.
Thanks, Haven. That's pretty helpful. I think I'll probably come back with something like a 6-month proposal in consideration of that, as like pulling back from the sort of quarterly model, but still kind of keeping in mind that one of our sort of license renewal requirements is presumably related to whether or not reports have been completed, and so making sure that that's not happening at the same time is important. I guess the other way we could structure it would be something like, if we were doing an annual report, would be having it come in and say the beginning of November, so it's in advance of the sort of expected renewal period, but I'm not a huge fan of that. Well, I think there's a few options. I will take this back and make some edits specifically to this section and see what people think coming up next month. Or is it this month too? It is still this month, the next meeting. I'm gonna stop my screen share for a sec here. Karen, did we have anybody looking to do public comment beyond the RAC members? Okay, well, I will assume that's a no then. I wasn't expecting anything, but.
Hi.
Yeah.
I finally got unmuted here. Like I said, it's slow on my end. No, I have not received any requests for public comment. and correct the meeting. The next meeting is at the end of the month of October.
All right. Well, so I have two rule captions left in here, one of which is, yeah, go ahead.
I was going to say, on the actual data that needs to be reported that I think is actually in the regulation that you just had, I wanted to talk about that real quick if I can.
Yeah, of course.
So the first being that the amount of time spent with an HCP, I'm not aware of any system that allows that to be captured. Is it an assumption that they're looking for? Are they looking for 5 minutes, 2 minutes, 3 minutes? Most interactions with HCPs are minutes. So there's no system that allows you to capture that. Then my second question is value of samples. Statutorily, you cannot, samples have to be free. There is no value, no price that is put on those. It'd be a violation of federal law. So I'm a little surprised. Monetary value of samples.
Well, that's certainly potentially problematic, and we wouldn't, obviously, if it's conflicting with federal law, we wouldn't interpret the statute in a way that requires that. So I think that is one I will take back to legal, just to make sure where we are in terms of interpretation of that for the provision. So these, I believe that comes from, yeah. So for saying I wasn't going to duplicate the statute too much, I have quoted directly from the statute quite a few times. Location and duration of the licensee's contact is in the statute.
Yeah, I don't know how companies will comply with that, other than an assumption document.
And this is Merck. I'm not sure if I'm unmuted.
We can hear you.
You're good.
Thank you. This is James Matucci with Merck. This is an area that Merck is, also has a concern with, not the location necessarily, but the duration. Our current tech platforms for our reps across the country don't allow for us to account for the time made in contact with a healthcare professional. And there's a GPS concern with this as well, that if we're asked to rely upon that, you go into a large building with multiple providers, or if you were to ask the rep to provide an exact amount of time that contact was done. Those are all areas of concern with filing a state report and committing to that, the accuracy of that number. If there's a way to provide even just perhaps the term estimation in front of duration, and allow for a certain variance there, then I think that's an area that we can get around. But our current platforms don't allow for us to account for that reporting requirement.
Agreed.
And just also to close the loop on that, this is a requirement in the Chicago language, but we haven't been asked to report in Chicago. So it's not a barrier that we've had to overcome there. The particular content of Oregon's language would have us confront this right away, which is why we're articulating this now.
Appreciate that concern being raised. I certainly will try and consult with Chicago on how they've chosen not to address that, given statutory requirements. I'll look at that. Do the proponents of the bill see any problem with doing something like estimated time of visit? Like something like in the range of quarters of an hour, for example, rather than trying to track more detailed. It isn't specified how granular this needs to be in the statute.
And as I said, most are in minutes. You're not even at the 15. I sold for 10 years, so I know.
Yeah, I think as long as there's kind of clarity about what those estimations are and it's not too huge of a range, something like that might work on what the example you gave was, Numi.
Okay, appreciate that.
Yeah, and I'm with Chloe on this one.
Yeah, and as far as the samples, you might want to go back and look at that. You know, I think drug companies would really have a hard time putting a value when they're not to be sold. There's no value, there's no price. There was a whole diversion concern from the federal level back in '88. So usually we don't assign a value. You can't assign a value, they're free.
Yes. No, I mean, I understand that, and certainly don't want to come into conflict with federal law in any way in terms of our interpretation of the law. Well, I have 2 rule captions left, and unfortunately, I do have another meeting after this. So I'm going to go ahead and kind of go through closing thoughts, and we'll reserve those last 2 sections. So that's the prohibited conduct and civil penalties and license civil penalties sections. We will leave for our next meeting. Just kind of talking next steps. Next RAC meeting we have set for October 26th at 9:30 a.m. We have a 3rd RAC meeting set for November 16th at 1:30 p.m. So that is, and it looks like I got it 1:30 to 3, same as this meeting. Hopefully we will have all of the details ironed out in 3 meetings. If we do not, we will schedule more. As I had said, the sort of intent is to get a temp rule in place for the initial implementation on Jan 1, and then we will have a final rule as soon as possible after that. Kind of some of the details. Hopefully everything will be more or less the same between the temp rule and the final, but that's where we are. I have asked for written comments to be submitted back to me by close of business on October 19th, which I believe is the Tuesday before the 2nd meeting. The reason that I have done that is so that I have a week with everything that has come back in, so that whatever changes, so that I have time to make changes to the rule based on written feedback as well as on any the pieces of verbal feedback that we received today. So that is why the timeline is maybe shorter than some would like, but I think that still gives you 2 weeks. So I'm giving you 2 weeks. I'm only giving myself 1 week. So that's seems fair to me. So that concludes the business for today. Again, still open for if people who are not currently listed as RAC members would like to be listed. I'm open to hearing things, though I don't want to get overrepresentation for any particular interest group. So that I'm not saying I'll accept anyone, but am open to interest from other parties. So any closing thoughts, questions from anybody before we shut this down for the day? All right, hearing none. Karen, have I missed anything, or are we?
No, I was just going to say that I'll be sending out the calendar invites shortly for the next 2 meetings. We just got our web page built for this rulemaking. So the meeting dates are on there, the time is on there. Today's meeting documents are on there, and there will be a recording from today's meeting that'll get posted or uploaded on that website. It just takes a little bit of time to do that.
All right, thanks, Karen. Well, thanks everybody for being here, and appreciate all the feedback and lively discussion, and look forward to seeing you all on October 26th. Thanks, everybody.
Thank you.
Thanks.
Karen, you can stop the recording.
Thanks.
Bye-bye.
Thank
Thanks.
you.
Thank you.
Bye.
I'm trying to stop the recorder.